our distinguished guest, good evening. Professor Marsh needs no introduction from me. The short movie that you have seen shows the extent, the magnitude, the impact he has made in the last 3 decades. Accordingly, I will use the time to bore you with a couple ideas. For an interview on May 12, 2009, with Kevin Marsh, Linda Nording of The Guardian addressed Kevin as the medicine man. The medicine man he is. The term carries a metaphoric meaning. However, it reflects on the reality of the person himself. Reality of the person who heals the ailments of societies through medicine. In such a manner, there are similarities between the recipient of the prize, Professor Kevin Marsh, and the person who the prize is named after, the late Dr. Abdurrahman Al-Sumait. Both of them graduated as MDs. They could have lived in the conformity of their communities. However, they chose a different path. They chose the path of serving humanities, healing their ailments. Both fell in love with Africa. Both had the vision and the idea that the cradle of civilization can be in the path of progress and in the path of economical and social development according to the moving the center of research to the African continent. Kevin's achievements earned him many recognitions, the last of which was Al-Sumait Prize for African Development in the field of health in 2015. With this being said, and this very short idea, please join me in welcoming Professor Kevin Marsh.
Well, thank you very much indeed. So, distinguished guests and dear friends at KFAS, the first thing I must do is thank you all, both for being here this evening, but also KFAS particularly for allowing me to come to Kuwait for the first time. When I was lucky enough to receive the prize, I was asked would I come to Kuwait and talk about some of the work we've been doing, and I said I would love to. And so this is the realization of that aim. What I'm going to talk about this evening is not so much my own work, although I will mention it a little bit. I'm going to take a broad view of things that are happening and going to happen in Africa over the years to come. Now, obviously, whenever you sort of try and say what's going to happen, there's a big element of you may be wrong. So what I'm going to do is look at the present and the future of health in Africa, and I'm going to try and convince you that the future will be very different from the past. I will talk a little bit about my own work, and I will also talk at the end a little bit about what we've been able to do with the Al-Sumait Prize. I think the first thing, whenever we talk about Africa, is to recognize just how big the African continent is. You can fit into it all of Europe, all of the United States, India and China, and still have room to spare. So I think we often don't recognize just how massive the African continent is in the world. And when we recognize that, and when we recognize that it's made up of 55 countries, you can legitimately ask the question, does it make any sense to talk about Africa? Does it make any sense to talk about the future of anything in Africa? Because it's a massive continent, it's massively diverse, and perhaps we shouldn't generalize. Well, some people think they can generalize. Many of you will read The Economist, and The Economist thought that it could generalize about Africa, and it got into a lot of trouble, quite rightly for it, especially for the cover which says the hopeless continent. But I've put this up because I think it shows the way that people outside Africa often conceive of Africa and generalize and make statements in a way which is simply not the reflection of how the continent is. The cover that I particularly like is the hopeful continent, and I hope that my talk will refer to a hopeful continent, but certainly not to a hopeless continent. But the other thing when we're saying, can you talk about Africa as a whole, is we really need to decide, well, which Africa are we talking about? In most people's minds, often the picture is of rural Africa. And of course, much of Africa is rural. But what people often don't recognise is that much of Africa is not rural. And on the bottom picture, many people are surprised to find that many African cities look like this. Many people's mental image of Africa is of a rural country, not of developed cities. But of course, there are many highly developing and developed cities in the African continent. But I think there is one reason why we can legitimately talk about Africa as a whole, despite its size and despite its many countries. And that is, uniquely amongst the continents of the world, all African states have come together to have a common vision for the continent. And this is expressed in this document, Agenda 2063. So it's looking a long way ahead. And it brings together the views of African countries on the future that we want in Africa. So I think in that sense, we can legitimately talk about the future of Africa, but bearing in mind always that it's an incredibly diverse continent with many, many countries, many, many cultures, many languages, and really very different stages in relation to health and to many other things. So I'm going to now divert very briefly to my own experience. So I spent pretty much all my working life in the African continent, at first in West Africa, in the Gambia, and then from 1989, living in Kenya, and I've marked there Kilifi on the coast of Kenya, almost exactly on the equator. And that's where I lived and live. I lived there permanently for 25 years, and I still live there and spend quite a lot of my time there. And we went to Kilifi to work with the Kenya Medical Research Institute on malaria, which is my, as you've heard, that's my particular area. Now, the next two pictures I'm going to show you are not meant to fall into that trap of the bad picture of Africa. They're just simply to give you an indication of what Kilifi looked like nearly 30 years ago. And then at the end of the talk, I will show you what things look like now. And I think then you'll agree with me that we've got a lot of room for optimism. So when we went to begin our work in Kilifi, these were the buildings that we worked in. This was the Kilifi Research Unit. It's a bit grand to call it a unit because the only people researching there were myself and a couple of colleagues. And I'll show you what the Kilifi Research Unit looks like now at the end of the talk. And this was the causes of death. Now, I don't want to go into any detail about this. I realise some of the audience have an interest in health and medicine, some don't. For those that are interested, on the pie chart, it tells you what you would expect. That in Kilifi Hospital, the major causes of death were nearly all infectious diseases. Malaria, measles, very surprisingly, pneumonia, and so on and so forth. But the key point there is that childhood mortality was 116 per thousand. Now that means that out of every 1,000 children born, more than 20% were dead before their 5th birthday. Now that was the childhood mortality in Kuwait in 1960. So you have to go back nearly 60 years to when Kuwait was like that. So that was the position. Obviously, childhood mortality in Kuwait now, well, someone in the audience will correct me, but I think it's around about 8, which is the same as most areas of the developed world. So just have a comparison, the coast of Kenya in 1989 was like Kuwait in 1960. So I'm going to leave my own experience there, and I'll come back to it at the end of the talk and hopefully give you some causes for optimism. But I think even if we're optimistic, we have to begin by being realistic. And this summarizes the current situation on the African continent. Africa has 15% of the world's population, but it has 25% of the world's health burden or disease burden. But it only has 3% of the health workers in the world, and only 2% of the economic resources. And when it comes to research, the way we lay the future for better health, only 1% of the researchers. So if you look at that disparity, 25% of the disease burden, but 1% of the researchers, 3% of the health workers, and only 2% of economic resources compared with the rest of the world, you can see that there are some major challenges when we think about health in Africa. So that's our starting point. But I'm going to argue that this picture is going to change, and change very rapidly and more dramatically than most of us would imagine. So I'm going to argue that the interaction of a set of transitions will profoundly shape the future of health in Africa. And I've put health in brackets because I actually think the same transitions which I'm going to talk about will shape the future of Africa as a whole, not simply the health of people in Africa. Now, the first transition is what we could call the epidemiological transition, by which we mean a change in the patterns of ill health, change in what kills people and when it kills people. And I've illustrated the first part of this change in what's happened to childhood deaths over the, is that arrow showing? Yes, it is. What's happened to childhood deaths. So if we go back to the 1990s, mid-1990s, when we set the Millennium Development Goals, each line represents childhood mortality. So 300 means that 300 out of every 1,000 children die before their 5th birthday. The red line is the world average. The green line is the industrialized, so-called industrialized OECD nations. Very low childhood mortality. Kuwait would now be down here as well, of course. And not surprisingly, top was Africa, with very high childhood mortality. But the key issue is that in the 1990s, when the Millennium Development Goals were set, Africa was drifting away from progress of the rest of the world, and the chances of it coming towards the Millennium Development Goals seemed remote. But what actually happened was very dramatic. You can see here that there was a sudden acceleration in progress so far as childhood deaths in Africa was concerned, and a really dramatic reduction in all-cause childhood mortality over the last 17 years or so. So that's the first part. Now, why is that? Well, the reasons are complex, but one of the reasons, and for those of you who came to my talk yesterday on malaria, I went into some detail about this. One of the reasons, I believe, is because malaria has changed a lot over the last 17 years or so. These two maps represent the African continent and the amount of malaria. Now, we don't need to go into the details of what the amounts are. Most of these maps, I'm sure you're familiar with looking at them in all sorts of contexts. Basically, red and yellow means bad, and blue means much better. And it doesn't take a statistician to see that the second figure is a lot different to the first figure. And this is perhaps most easily understood by looking at the bottom figures, which is that we estimate that over 600 million cases of malaria have been averted since 2000, in the 15 years from 2000. And that malaria mortality has been reduced in Africa by nearly 70%. Now, that's an extraordinary reduction in a short time. But more than that, we know that reducing malaria causes a massive general increase in child health beyond malaria. So at least one of the explanations of the changes we're seeing is the change in malaria. Now, the same thing is happening with many other infectious diseases. As better vaccines are developed, child health is improving rapidly. The other side of this coin, and I know there are people in the room who are particularly interested in this, is, well, if infectious diseases are going down, what's happening to those diseases which are not infectious diseases? Now, this map, I think, shows something which, at first sight, many people are surprised by, because this maps out the chances of dying prematurely from the classical non-communicable diseases. That's to say, diabetes, heart disease, cancer, and chest disease. And again, red is bad, brown is middle, and yellow is not so bad. And many people, when they see this map, say, no, this must be the wrong way round, because we know that the non-communicable diseases are a problem of the so-called industrialized countries. But the reason this isn't the wrong way round is because this is a map of the chances of dying prematurely. Now, if you were to put the chances of dying at all, of course, the traditional industrialized countries would show red. That's because we all have to die of something. So we can't escape death. But if we ask what kills people during their active adult life, already non-communicable diseases, the problem is not in the OECD countries. The problem is particularly in Africa and Asia and the former Soviet Union. So it's quite the opposite to what most people consider. So this is going to be this combination of reducing infection but increasing cardiovascular disease and diabetes in older people is going to shape very much the health problems of the continent. Now, the second massive transition is the demographic transition, the way the population of Africa will change. Now, this map, which some of you will say doesn't look quite accurate, and that's because rather than a geographical representation, it shows the land mass corrected for the population. And this is in 1950. So this is the world if you adjust the landmass for how many people were living there. And you can see that Africa looked quite small. India looked pretty big, but Africa looked quite small. This is what it will look like on current growth rates at the end of this century. The only place, really, in the world, this is a ridiculous thing to say, really, but to a first approximation, Africa will be the world. Africa's population is growing at such a rate that by the end of the century, India also will be big, but it will dwarf the populations of Europe and America. So this is going to be a massive change, not just in health, but this is going to be a massive change for the world, that Africa's population. Now, in Africa, we regard this as a dividend, a demographic dividend, because, and the reason we regard it as a dividend is because the population will be incredibly young. So some of you will be used to looking at these charts and some won't, so I'll just explain what these charts show. Along the axis here are just age groups. So these are people aged 0 to 4 years, 5 to 9 years, and so on and so on, right up to the oldest part of the population, people who are 80. And then the distribution of those age groups is shown for 3 countries. This is what the population looks like in a population undergoing slow growth, the United States. So there are quite a lot of young people, quite a lot of middle-aged people, quite a lot of older people, and then a reasonable number of considerably older people. This is what a country that's gone into negative demographic growth looks like. This is Germany now. Completely different. The pyramid is getting tipped upside down. Very few young people to support the society to look after the older people. This is what DRC looks like. The opposite completely. Very, very young people. And this goes along, of course, with that massive population growth. So we're going to have massive population growth of young people, and that's a dividend under some circumstances because there will be a productive workforce. Of course, it may not be a dividend under some economic circumstances, but whatever the case, it will shape the future of the continent and to a great degree, I think, the future of the world. The next transition is urbanization. We're used to thinking of Africa as an urban continent, but in fact, even now, as a rural continent. But even now, over 40% of African people live in urban areas, and in 17 years' time, the majority of African people will live in urban areas. By the end of the century, Africa will essentially be urban. So we're used to thinking and picturing Africa as a rural continent, but it will be an urban continent in the future. The next transition is a critical one, and that's the economic transition. Now this map, and again it's one of those where the darker you are, the better it is, but basically this shows economic growth in Africa, and this was in 2016, and it looked back on the previous year. And the take-home message is that only a couple of countries, Libya for obvious reasons in 2015, showed negative growth. The majority of countries on the African continent show positive growth, and shown here is the GDP unweighted average growth over from the 1980s to 2015. So this is a period of nearly 35 years. And you can see here the Asian countries, which of course went through their growth spurt in the 60s and 70s, And this is the African continent with sustained high levels of economic growth. Now, no one can guarantee, obviously, that economic growth will continue. So we don't know if this will be sustained next year and the year after and the year after. But on the trend so far, African economic growth is the only part of the world which has been growing strongly over a long period of time. Now, that will obviously be the determining factor on what the implications of population growth and the other changes that we've talked about are. But at the moment, we're looking to that as being a positive change. Our fifth transition, and this is a transition that's happened all over the world and certainly here in Kuwait, but more so probably in most African countries, and that's the change to mobile phones. Now, you may think this is a strange thing to put in on a talk about health, but the reason it's very relevant is that so many health messages, both health messages to people, but also so many health logistics can be solved by good mobile telephones. Things like stocking stock levels in rural dispensaries, things like sending messages to people to remind them to take their drugs, their anti-malarial drugs or their anti-HIV drugs, are increasingly being done by mobile phones. Now, the figure, the graph, shows the growth in what's called mobile penetration. So this is in millions. So that is a billion at the top. So Africa went from no mobile phones in 2000 to nearly 1 billion mobile phones now, and there are 1 billion people in Africa. That doesn't mean that every person in Africa has a mobile phone, because some people have got two. But what it means is that everybody's got access to a mobile phone. Everybody on the continent knows somebody with a mobile phone. And the reason why this is particularly important in comparison with, say, Europe and America, is that when you've got systems which don't work, it's very easy for systems which do work to replace them. So the situation in most of Africa, certainly in Kenya, when I first lived in Kenya, was that the landline system for telephones did not work. They were always broken. You spent your whole life trying to get them repaired. It wasn't even worth it. With the consequence that when mobile phones came in, everybody just gave up their landline. I haven't had a landline in Kenya for years. I would not dream of having in my house a landline. We only use mobile phones. And that's because it's easy, if the system is not working, to displace it with a system which works. So as a consequence, mobile phones have taken over Africa far more rapidly than is the case in most of the world. And they have applications well beyond simply sending messages to people. They have all sorts of implications for managing health problems. And related to that is the transition to what I've called telemedicine. So this also, of course, requires reasonable connectivity by the internet or by telephone systems. But increasingly, a lot of interest in many African countries in using telemedicine. That's to say remote diagnosis, remote advice, so that you can overcome some of the issues to do with a reduced medical workforce. If you see an example on your right there of an ultrasound scan being done and then relayed to a central facility many hundreds of miles away, where somebody will report on it and report back to the clinician or the clinical officer at the site. And in this way, the combination of telephony and good internet connections, which are increasing all the time across the continent, means that the practice of medicine will change considerably. My next transition is what I've called the technological transition. Now, you might say that mobile phones are a technological transition, but there's another set of technological transitions, which is in diagnostics and so-called personalized medicine. Now, some people may recognize what these are. These are machines which we used to use for sequencing DNA. So some years ago, the human genome was sequenced at a cost of a couple of $1 billion, took some years, and it took rooms and rooms and rooms full of these machines working for several years to tell us the sequence of the human genome. You can now sequence a genome with this in a couple of hours attached to your mobile phone. So what was almost impossible to conceive of 15 or 20 years ago can be done trivially now. In fact, the problem is not the sequencing, the problem is understanding the information you get, and that's another issue. Now, some of you, and it isn't, I've used this example because I think this is particularly incredible that you can sequence a genome in a short time on something on your mobile phone. But the same technology obviously applies to all sorts of diagnostics. There's practically no sophisticated diagnostic that you cannot adapt to work in this kind of way. Now, some of you may be thinking, I've seen this kind of thing before. Now, I don't know how many people in Kuwait ever watched Star Trek, but some of you will recognize. Now, when I used to watch this as a young person, I used to think this will never happen in my lifetime, but this is happening in our lifetimes now. So the whole diagnostics will change, and it will completely change the practice of medicine. The final transition is something to bring us back to earth, because whatever clever technical changes there are, you can't do anything without a good health system in one way or another. So one of the big demands is for proper health systems. Now, again, I think things are now optimistic. The current Director General of WHO, the first African Director General, Dr. Tedros, has set universal health coverage as his single major aim as Director General of WHO. Universal health coverage has become the thing which everyone's aiming at, and this obviously has a direct impact on the quality of health systems. So the World Bank and the Global Fund committed recently $24 billion in Africa towards universal health coverage. But I think it's important to recognize that, in fact, in the future, this funding will come from within Africa. It won't always require international funding. So if we add up all the changes we've talked about, and then the changes in health systems which will come from good health coverage, you can begin to see that it is possible that the future of health in Africa will be very different from what we've been used to. Now I'm going to return to Kilifi. At the beginning, I showed you what Kilifi looked like in 1989. Well, firstly, what happened to childhood deaths? Well, the pattern did change, but more than anything, the numbers changed. So there was a 75% reduction in 25 years in childhood deaths, matching the figure that I showed you at the beginning. So, and for those of us who are working in the hospital and looking after sick children, this is an incredible experience to see death rates go down in a relatively short time. I also showed you the research unit in 1989. I'm happy to say that this is the research unit when I left 4 years ago. And again, I think it shows that things can change very rapidly. Often we look to the future and we think it will take forever. But in fact, things can change in a big way very rapidly. When I was preparing this talk, I asked Mustafa yesterday about who will come to a talk like this. And I thought probably most people will have some interest in health. And he said, well, yes, but a lot of people are actually interested in business and technology. So I put back in 2 slides which I'd originally taken out. And the reason I put them in is because we often think that all these changes will require investment from the outside by international organizations. And I feel very strongly, and I won't go through the argument now, that in fact most of this funding will be generated by Africa itself and partly related to the economic growth. But I also wanted to show those of you who are interested in entrepreneurship, and some of you may be aware of this, the Business Sustainable Development Commission made a report looking at the economic implications of achieving the Sustainable Development Goals. And their estimate is that globally, because of course these are global targets, is that achieving the global goals actually creates at least $12 trillion in business opportunities. So the reverse of how we normally think of these things as requiring pouring in of money from international donors, achieving the goals potentially creates massive opportunities, particularly in a growing economy. Now that's for the world, but obviously Africa represents a large proportion of that. And for those that are interested, these are the lists of things which they believe the biggest opportunities for growth in terms of entrepreneurship in relation to development are. And they come under the heading of food and agriculture, cities and energy. But the one obviously in relation to this talk that I'm particularly interested in is health and well-being. And you'll see there that many of the things I've talked about, remote patient monitoring, telehealth, advanced genomics, are exactly the things which the Commission also believes will be a source of great opportunity so far as entrepreneurship and business is concerned. Finally, in my next few slides, I want to just tell you a little bit about what the Al-Sumait Prize meant for me. I was incredibly honoured to be given the prize. I think it's a wonderful prize. I think, and we've talked about this a lot in the last few days, I think the Al-Sumait Prize has really, across the academic community in Africa, has put Kuwait sort of in the forefront in a way that it wasn't before. Now everybody in academia knows about the prize and everybody wants to be nominated for the prize. And so it's having a massive sort of impact in terms of knowledge of Kuwait. And I personally felt it was very important that we use the prize to leverage and gain more. Just as I gained from the honour of having the prize, I felt that the actual money ought to be used to leverage what we're most interested in. So I want to tell you a little bit about the critical role which I believe the Al-Sumait Prize, for me, had in supporting the development of a knowledge-based economy. So I showed you this earlier. This is the plan for Africa. It requires knowledge-based economies, and knowledge-based economies require strong institutions, strong universities, strong research institutions, and that's a challenge. So that's my interest, is how one builds strong research institutions. And so I split the prize money, which I was lucky enough to get, into two parts. And the first I donated to the African Academy of Sciences. Now, the African Academy of Sciences, where I spend half of my time, is a Pan-African academy. That's to say we have fellows from countries right across the continent, which supports excellence in science in Africa. And we have a specific, and this was mentioned earlier, we have a specific aim of shifting the centre of gravity for science to Africa, instead of science being from elsewhere coming into Africa. Whoops. Now, the Academy itself has, at the moment, around about 400 of Africa's leading scientists. We recognise excellence, we provide thought leadership, and build programmes to support science. But we also have a group of people called the affiliates of the Academy, and these are the emerging research leaders for the continent. These are researchers across a wide range of fields: health, engineering, agriculture, chemistry, a whole range of sciences, under the age of 40. And so they're the future leaders for the evidence base on the continent. And about 3 years ago, the Academy started the affiliate program. The problem was there was no funding at the time for the affiliate program. So half of the Al-Sumait Prize went to developing the program. We've appointed a coordinator and funded the activities. So now we have a program for a wide range of emerging research leaders across Africa in many different disciplines in many different countries. So I think that's a really high impact from the prize. The other half of my life is spent in Oxford, and there I run something called the Africa Oxford Initiative. Now, the Africa Oxford Initiative aims to make collaboration with Africa a strategic priority for Oxford University. And you might think that's a strange thing for one of the world's global universities to do, but we've argued that Africa is going to be so important that all global institutions have to have an approach to Africa. And so our aim is to make Africa a strategic priority for the university in every area, not just in science, not just in health, in every area of academic enterprise. And we support the development of equitable research partnerships across all disciplines. And so with the other half of the Al-Sumait Prize, we were able to set up a travel grant scheme to bring African and UK researchers together to form new collaborations to tackle developmental challenges in Africa. The numbers are slightly out of date. In just over a year now since we've been running it, we've funded 70 of these partnerships. So these are either African researchers coming to Oxford or vice versa. So the combination of this and the affiliates means that the Al-Sumait Prize has been able to support around about 130 emerging African research leaders spread across now more than half of the countries across the continent. And I think that's a massive leverage and gain from a prize. And I hope that that's what both KFAS and Dr. Al-Sumait would have wanted to see happen to the prize. So I'm going to sum up now what I've been talking about. I think that health in Africa is at a critical point of transition. We're in the middle of complex epidemiological changes in infectious disease and in non-communicable diseases. Africa's demographic growth will shape the future of Africa and, in fact, of the world. Africa's past was largely rural, and in the future it will be urban, not entirely urban, but much more urban than many of us have imagined. Africa's health systems are changing, and they'll be funded from within Africa in the long run. And there are a whole set of new technologies which offer transformative possibilities for just jumping over the problems that we have now. And that's the optimistic view. But I've put at the bottom the caution, and that is that the future obviously depends on economic, social, political, and governance transitions. Clearly, if the economic development doesn't go well, if the political transitions don't go well, if governance isn't established, then what looks like an optimistic future could very rapidly change into not an optimistic future. But personally, I'm an optimist, and I hope all of you are optimists. So my own view is that the future of health in Africa and the future of Africa as a whole is something which is going to be exciting to be part of. And once again, I'm delighted to have received the Al-Sumait Prize because I think this is a really fantastic contribution to the development of Africa's future. So thank you very much for inviting me to give this talk.
Thank you, Professor Kevin, for an illuminative lecture on the future of Africa, the cradle of civilization, and again, hopefully, the center of gravity for research. We can take a couple of questions at a time, please. Dr. Salim.
Thank you very much, Professor Kevin. It is our honor to have you with us today. And while you are speaking, I just remember Dr. Abdurrahman Smith. You have many common things between you and him. You are consistent, and you are optimistic, and you never give up. So we would like to thank you for that. And also, I thought of having you to win our Sumait Prize every year, if you utilize it in this wise way, or somebody like you.
I'd be very
so
happy.
we'd like just to thank you again on behalf of KFAS and the people of Kuwait for putting such honor and wise standard for our prize. Thank you very much.
Thank you very much.
Any other questions? Please.
This is Professor Jean Vega Sana. I'm a new faculty of Public Health at Kuwait University. This is one of the best talks I ever attend to on Africa. I was born in Rwanda many years ago, and when I went back, and what I saw, in fact, confirmed what you just told us. In fact, when you look what's happening in Rwanda, it's just amazing. They really from nothing, now they improved. I think your talk really it confirms what the Rwandans did, and I think it's really worth supporting. And I congratulate you for the hard work. And one of the reasons, actually, I think you were very effective because you lived with the Africans. And I have a story because my training is in occupational and environmental medicine. Alice Hamilton was in Chicago. The way he was able to put forward the occupational health and safety, she lived with the workers. They didn't have running water. They didn't have toilets. She will sleep with them in the same shelters, and she was able to go to Germany, get all the science, and then just basically she was a woman, and she was able to change the whole occupational health and safety in America. So it's possible. I'm optimistic, of course. If you from Rwanda, then you be here in Kuwait, I had to be optimistic. Thank you.
Thank you.
Hi. Thank you, Professor, for the amazing talk. I'm an urbanist, my background. So for me, I think one of the main concerns that I have when it comes to Africa is this urbanization trend. Most of the urbanization in Africa is unplanned urbanization.
Yeah.
And I think the Ebola crisis showed how this outbreak was mainly due to this unplanned urbanization and how local governments were not able to handle this type of crisis. They didn't have the resilience or the infrastructure to deal with it. I'd like to know more about how this Ebola crisis affected the research scene in how to considering urbanization and infectious diseases in Africa.
Yeah. Well, thanks. No, and you're of course absolutely right. I think unplanned urbanization is going very fast, and it is a concern. And I certainly didn't mean to give the impression that urbanization will result in beautiful cities. I mean, parts of them will be beautiful and parts of them will be very unplanned. And that does present massive health risks. I think the Ebola crisis was partly urbanization. I think more than anything, my understanding at least, is that it was very, very poor health systems, whether they were urban or rural. It just happened that in the 3 countries affected, the health systems were not strong at all, urban or rural. But it remains the case, as you've said, that in very high density, unplanned populations with poor sanitation, poor access to health, the concentration of people both represents a problem from the point of view of the origin of infectious diseases and the rapid spread. So this is a great concern. So how did it affect the research scene? Well, in some good ways and in some bad ways. I think the good ways were it drove forward the pressure to develop an African Centre for Disease Control. So there is now an Africa CDC, modelled on America's CDC. It's based in Addis in Ethiopia. So that's a good move. I think some bad things which may turn out to be good things were that there was a flooding of researchers from outside the continent who meant to do well, meant to do good, but inevitably just the sheer volume meant that it really wasn't necessarily always helpful. But I think what that has done is drive African researchers to realize that we have to get the house in order, have to be better prepared. And there is a lot of preparation going on within African centres now for future epidemics. So I'm not complacent at all. I think you're absolutely right. This is a big threat. But I think the Ebola crisis has made us realize that we've got to move within Africa to put in place the expertise, the epidemiological expertise, the public health expertise, but more than anything, the political changes, and that's the hardest bit, as you know, as an urbanist. I mean, this is not just in Africa, this is true everywhere in the world, it's true throughout South America. Changing those patterns of unplanned settlement is incredibly difficult, and I think that's a political challenge, not a health challenge. I think it presents a health challenge, but its solution is a political challenge. So thanks for raising that problem.
Can you see me now?
I can see you. I could see you from the beginning.
I can see you too. Dr. Marsh, I'm curious about, there were 2 major viruses, or maybe more viruses, that originate in Africa, like the AIDS, the Ebola virus, about 15, 20 years ago. To what extent has this been tackled and one needn't worry about new viruses coming out of Africa?
Yeah. I think we need to worry about new viruses coming from everywhere. It happens that a number have come out of Africa, the ones you've mentioned, also some others, Lassa, Marburg, and so on and so forth. But of course, a lot of new diseases have come out of Asia as well, particularly some of the virulent transitions in influenza virus, SARS, and so on and so forth. So I think the issue is new infections in general, and very often jumping from animal hosts. So if you take the example of some of the respiratory ones from Southeast Asia, it's related to very high densities of chickens, related to very high densities of people with chickens. In Africa, the transition is often from the change in environment, species which used to be away from humans are now close to humans, partly because of changes in land use, partly in changes in sort of social activity. So we should be very worried about it. And in fact, I think it is certain that we will have at some point, who knows when, it could be 10 years, it could be 50 years, it could be 100 years, we will definitely have global pandemics which will kill many, many millions of people. That's what's happened throughout history. That's what happened with the plague. The biggest pandemic was the influenza pandemic after the First World War, which killed more people around the world than the entire First World War. We've tended to forget that in our cultural memory, as it were. But the biggest pandemic in our, in recent years was flu. So I'm sure that at some point we will have a massive pandemic. It'll probably be a virus. It'll probably emerge from animals. It could be in Europe. It could be in Asia. It could be in Africa. And we should try and prepare for it. But, you can't prepare for what you don't know. So I just hope it doesn't happen in my lifetime. Which is a very selfish way of looking at it.
First, I would like to thank you very much for your inspirational speech. It really got to me. I initially used to work for the Canadian government back in Canada in Ottawa. I came to Kuwait just to see what my background and culture was and whatnot, so I decided to teach. As a teacher, I started teaching with geography to begin with. I had some students who were very interested in Africa in general. So when we talked about Africa, a lot of them showed me pictures of what you showed us earlier, where it's just little huts and whatnot, little villages. None of them had pictures of actually the urban areas, the cities, like the beautiful cities they have like in Nigeria and Ethiopia and whatnot in South Africa. So I got into it. I talked to the director of the school, told them we need to open up more to the school, build awareness about Africa in general. And as the doctor from Ghana that works in KU said right now, it's extremely important to build awareness in our system, our society. So as soon as my students saw that there are places in Africa that don't have water or they have very dirty water and that millions of children are dying from this dirty water, they took the initiative, went to charities in the area to build wells. So I think one of the biggest issues we have within the world is just building awareness for Africa itself.
Thanks for that, and congratulations on being able to achieve that with your students.
Well, let me first of all thank you very much, Professor Kevin. Really, thank you. I just wanted to stand in front of you, humbled by Kevin Marsh, my very good friend. And he's now a very good friend of not only Africa, but Kuwait, and everyone in Kuwait must be thankful for what Kevin Marsh has done in the past. But he really set the standard of the prize, and what he did in donating a prize of $1 million to the cause that he had dedicated his lifetime to is something very admirable. And I really thought it was my duty to say thank you again, not only for accepting our visit, for accepting the award, or for what you have done now and what you're trying to do in the future. I spent today with Kevin in my office and also in a few offices of very senior people here in the development funding. And Kevin, in very simple words, convinced many of the people that he met today about why it is important to leverage whatever one has as a resource to put it for good cause. And he did it very humbly, but very eloquently, and I can assure you we will be with you all the way, because I think you are the type of Al-Sumait Prize winner that we all think should be the standard. So thank you again. I wanted to thank all of the excellencies, the ambassadors, the academics, the young people, the health people who are with us here. And I think what I want to encourage you is to read about the Al-Sumait Prize in the website. By the way, it goes every year, every 3 years it goes into a different field. So last year was education, and the year before that was food resources, and 2018 is again health. The nomination is still open until June 30th this year. So if any one of you would like to spread the word, just go to our website or Al-Sumait website and read about it and spread the word. I think what you heard from Professor Marsh is that what he did spread the word in Africa so that academic community in Africa knows very well about Al-Sumait Prize. I would like to see the academic world community in Kuwait, in Arab countries, in Europe, in America, know about the Sumait Prize, and that it one day will be at par with the Nobel Prize, perhaps. Thank you again. Thank you, everybody. And there is, for all those of you who did not have a chance to ask questions to Kevin, there will be a reception in the lobby, and I'm sure he will be delighted to spend as much time as you'd like. And I would encourage the ambassadors, the young people, the academics to be with Kevin Marsh for the next half an hour or 1 hour upstairs in the lobby. Thank you very much. Please.